Hi, I'm Bridget Lees. I'm the Executive Chief Nurse here at Walkabout. So I set up Harm-Free Care panel after listening to colleagues, and it was really clear that we didn't have a space in terms of being able to discuss some of our clinical practice, particularly in nursing and allied health professionals, but in terms of the practice we were delivering and learning in a way of continual improvement. And so we introduced it particularly around what's called, we're currently working on our RSP programme on our fundamentals of care, and two aspects of that were related to improvement in falls and pressure ulcers. What happens weekly in terms of colleagues is that we look at our numbers of pressure ulcers and cases of falls, and colleagues have got the opportunity to come and present those cases in a learning environment. And we've got a number of different people there who've got different specialist interest, and we have debate and discussion about what went well and also how we can learn and improve. That's a really rich place of learning, and from that we've got a number of themes of where actually we can make improvements. We can hear from staff, so for me as the Chief Nurse it's really important that I listen and understand what's happening in our clinical practice. We can discuss the most recent evidence base in terms of how we deliver improvements, and hopefully it creates that environment of continuous improvement.
So hello, my name is Lynn Dack. I'm the matron for surgery here at Furnish General Hospital. As a matron, I am really excited that harm-free care, fundamental care is right up there now, and nursing is back on the agenda and in the spotlight. I have some amazing ward managers who have engaged their teams to make sure we're getting it right, to preventing harm for our patients and also ensuring that the fundamental care for our patients is absolutely where we focus our time and energy to prevent harms and to make our patient experience the best it can be. So the focus on pressure ulcers has definitely raised the profile of the work that we're doing. It's always been going on, but now the focus there to have eyes on skin and not just comment skin intact for a patient, but actually break down how we've assessed, what we've found and the actions that we're taking. And then the validation of a senior nurse when an incident is submitted to make sure that we're correctly assessing that skin and categorising that any pressure ulcers and what we're doing about it. It's just becoming so embedded that it can only make a difference for our patients.
Hello, my name is Nicole Dixon and I'm matron for the Hoggett Suite. The data around the numbers of serious pressure ulcers that Hoggett Suite has reduced enormously alongside the work that the ward team has been doing. Hoggett Suite haven't actually had any moderate pressure ulcers since the first couple were presented at Harm-Free Care, which goes to state that the actions are becoming embedded within that ward team and we're seeing real benefits with regard to patient care and reducing the harms. So the benefits of this work and the safety huddle as well means that the whole team at the start of every shift are able to identify the most vulnerable patients that are at the highest risk of developing pressure ulcers or deterioration of existing pressure ulcers, and that whole team system approach is around supporting each other to support these patients and ensuring that the resources for those patients are allocated at the start of the shift.
Hello, my name is Kim Crabtree. I'm the Interim Associate Director of Nursing for the Integrated Community Care. The Harm-Free Care panel gives us a process and a forum to review our incidents and our practice, and it gives me assurance that the care that we provide in community is safe and effective. Bridget kindly arranged to visit the team a little bit earlier than we'd normally do Walkabout, so she visited the team along with Lynn Wire at 8 o'clock in the morning to our Lancaster District Nursing team. It was really well received. They were so pleased that the team had made an effort to visit them, and we've got plans for that to be extended right across the patch on a regular basis.
So when I came into post, the first thing I did was create some space for me as a leader clinically to connect with the workforce and undertake clinical activity or review it. So on a Friday, gave some protected time to what matters most, which is connecting to our staff and understanding the care we're delivering. So on a Friday we have the harm-free care, which is in the morning, which we've talked about, reviewing our practice, and then from there it was both for me and for the senior leadership team in a way to connect with our staff. So Walkabout on a Friday is connecting with our staff regularly, discussions about our clinical practice, listening to our staff, understanding their concerns and seeing what we can do to help. It really matters to me that I understand and I'm clinically credible to understand what's happening with our colleagues, but also that we've got a collective leadership model and voice. So every Friday we're spending a lot of time out meeting with staff.
Hi, my name's Siobhan Callan and I'm the District Nurse Team Leader for Lancaster Cluster. So when Bridget came for her walk around as part of harm-free care, it was a really good opportunity for the team to be able to see who Bridget is and where these decisions are coming from that actually impact them directly. It was a really good forum for them to be able to raise any concerns, any questions that they might have that haven't been answered, such as the pricing of fuel and the use of cars in the community that's within the cost of living crisis at the minute, and also share some successes that we've had within the team as well.
Hi, yes, it's Andrew Thompson and I'm a matron for surgery and critical care at Royal Lancaster. I really enjoy the senior walk-arounds because for me I visit areas that I don't necessarily see all the time, so it's great to catch up with other members of staff, different teams, see how they're working on their area in their areas, and learning from what they're doing and celebrating what they're doing well, and yeah, just exploring what else goes on outside of my particular care group, I guess.
Hello, my name's Lorraine Fugler. I'm the ward manager on Ward 5 and SEAC at Berners General. So we've identified a need on the ward for the registered nurses to get sort of back to basic patient care, to know the patient's skin, and we're getting them to look at the patient's skin first thing in the morning, identify the need and set the standard for that day, and then sharing that with the rest of the colleagues that are on. So we're they're looking now at really thorough documentation, they're documenting each shift, identifying full patient skin head to toe assessments and documenting them in a ward note, and that's really useful and setting a really good standard.
Hello, I'm Diane Charlton. I'm the ward manager at Ward 4 at Berners General. The work around the fundamentals care is really welcomed by all. I do think that we are really starting to look under the covers as opposed to just the environment and around. So I'm very excited as a team to push this agenda forward and make our ward safer for patients.
I actually am happiest connecting with our staff and visiting clinical areas, spending time there. I understand what's going on then, I understand the challenges, I can listen, and it helps me be a better leader in that forum and represent the professions that I'm accountable for.
Hi, my name's Emily Henry Frankham and I am the Deputy Associate Director of Nursing in the Medicine Care Group. Yeah, so I'm doing a piece of work at the moment where I'm leading the End of Life Clinical Reference Group. This is a huge piece of work that has come from the Fundamentals of Care work stream, and we're looking to bring together all the experts across all the different care groups who work with patients who are end of life, so that's community, surgery and the medicine care group. Now this works really well with our harm-free care group that meets on a Friday. So every Friday we look at all the incidents where they may be learning and where we've done a review, and we share that with everybody to understand what we could do better, evidence-based practice, and I take themes from that group to the End of Life Clinical Reference Group. Well, I love the Friday Walkabout. I love the fact that all the senior nurses from different care groups meet up, so it's a real good chance to get to know one another and to be able to showcase best practice across different areas.
For our patients, nobody wants to be in hospital and receiving healthcare. They want to be at home or wherever they are with the people that matter to them. So wherever we can, it's the right thing to do to be able to influence our practice and deliver the best care, reduce unwanted variation, but most importantly, to be able to influence that in terms of our patients and their experience. What I've been blown away about in terms of the work that we've been doing is the enthusiasm from staff and the willingness to look at practice and to be involved and also lead. Because as the chief nurse, I can influence little actually. It's the people, it's you that are doing and undertaking the job that can make a difference to the people we serve. The most important thing for Morecambe Bay is that it's been a difficult year or two with lots of regulation, people assessing us, but yet what I see is a pride in the organisation. We are now starting to talk about what we do well, which is really important, and starting to create those conditions of continual improvement. So I am really proud, and you should be really proud of what you are doing, and what we need to do now is continue on this journey, and I think it's paying dividends, hopefully. And I know at times it's difficult, but we know that we're making improvements for the people we serve, and there's nothing more satisfying, and that's why we came into the role. So thank you.